Why does eardrum perforation lead to balance issues? Imagine your ear as a finely tuned system that helps you hear and stay balanced. When the eardrum, a thin membrane that separates your outer ear from your middle ear, gets a tear or hole, it can cause more than just hearing problems. While many people notice muffled sounds or some hearing loss, some might also experience dizziness or a feeling of imbalance. So, why does a perforated eardrum sometimes lead to balance issues? Let's explore how the ear's structure and function come into play. The ear is divided into three parts: the outer ear, the middle ear, and the inner ear. The eardrum, or tympanic membrane, is part of the middle ear and vibrates when sound waves hit it, helping you hear. But the ear's role isn't just about hearing. The inner ear contains the vestibular system, which is essential for maintaining your balance. This system includes tiny structures filled with fluid that detect head movements and help your brain understand your position in space. When the eardrum is perforated, it can sometimes lead to balance problems. Not everyone with a perforation will experience dizziness, but it can happen, especially if the injury or infection affects the inner ear. For example, a severe middle ear infection known as otitis media can cause the eardrum to rupture. If the infection spreads or causes inflammation, it can reach the inner ear, leading to a condition called labyrinthitis, which directly impacts balance. Another way a perforation might cause dizziness is through pressure changes. Normally, the middle ear helps regulate pressure between the outer environment and the inner ear. When the eardrum is damaged, pressure can fluctuate suddenly, especially during activities like flying or diving. These pressure shifts can disturb the inner ear's fluid balance, leading to feelings of dizziness or vertigo. Fluid leakage from the middle ear through the perforation can also play a role. If fluid or pus escapes due to infection or injury, it can interfere with the normal functioning of the inner ear. This disruption can temporarily impair your balance, causing you to feel unsteady or dizzy. In some cases, the injury or infection can cause inflammation of the inner ear structures, further contributing to balance issues. Most of these balance problems are temporary. As the eardrum heals, and if the inner ear is not severely affected, dizziness usually resolves on its own. However, if dizziness persists or worsens, it might mean the inner ear has been affected more seriously, and medical evaluation becomes important. From a broader perspective of ear health, a perforated eardrum is mainly concerning because it can impair hearing. The eardrum's ability to transmit sound is vital, and damage can lead to temporary or sometimes permanent hearing loss. Balance issues are less common but can indicate that the injury or infection has extended beyond the eardrum to involve the inner ear. To prevent such problems, it's important to protect your ears. Avoid inserting objects into your ear canal, shield your ears from loud noises, and seek prompt treatment for ear infections. If you experience symptoms like ear pain, drainage, hearing loss, or dizziness, consulting a healthcare professional is essential. They can assess whether the eardrum is perforated, and if the inner ear is involved, guiding appropriate treatment options. These might include observation, medication, or in some cases, surgical repair of the eardrum. In summary, a perforated eardrum can lead to balance issues if the injury or infection impacts the inner ear's vestibular system. While most balance problems are temporary and resolve with healing, persistent dizziness or vertigo should be evaluated by a healthcare provider. Protecting your ears and seeking timely medical care are the best ways to maintain both hearing and balance health. Always remember, individual experiences vary, so personalized medical advice is key to proper treatment and recovery.